got it from the mother would also have had breast cancer. Do you get what I'm trying to say? If she got, so it's gene, it's inheritance. If, for instance, someone's sister, brother, if my sister has breast cancer, and it's a BRCA1 or BRCA2 breast cancer, now she can pass it to her children, but I won't have any risk because it's my mother will be looking at. Because if she got that BRCA from my mother, then my mother would have been able to pass it to me. Okay. Now, you have heard Angelina Jolie had prophylactic mastectomy.
Yeah.
Because her mom had BRCA1, genetic. You understand what I'm saying? So you pass it down rather than pass it sideways.
So you can have BRCA1, for example, my mom can have BRCA1 and not have cancer, but then my sister.
It's less likely. If you have that BRCA1 mutation, it's more likely that you have cancer. But you might not have cancer. You're quite right. You might not. You can have the mutation and not have cancer because you need. So cancer genetics is slightly quite complex. Now I mentioned already with the way cancer is, the way cells are. The cells will tell you die, that kind of thing. So what that BRCA1 does, BRCA1 mutation does, that BRCA tells cells to die. So and if you now have a mutation in that BRCA, so the cells automatically don't just listen. So if you have so the likelihood that you would get other mutations that will then lead to breast cancer is quite high. So it's not necessary that someone has BRCA1 and they will always have breast cancer, but the risk is really high. It's close to 80-90%.
I wanted to ask a question in the back of the tomato comment. To my mind, it looks like most people from the part of what we call eat tomatoes, but in processed form. So the question is, do we get the benefit from eating it as salad or in a fresh form? The same thing applies to things like vegetables. We eat a lot of eforiru, but does the processing, the cooking, take away the benefit? Okra as well, things like okra.
Yeah. So cooking and processing, and processing in the sense of boiling does take away some of the things, like excessive boiling does take away some things. And you will even know yourself, if you boil eforiru, boil it enough, by the time you are pouring out the water, there's all the chlorophyll is gone. So you do lose some things in processing. But if it's just cutting and fresh, when they make tin tomatoes and things like that, there's no significant processing there, really. There's no boiling. Boiling breaks down cells and things. So boiling does remove some things. Not everything, but it does. Yes, sir. Yes, sir. Yes, sir.
Thank you, doctor. My question is, are there some form of self-examination that one can do before one starts experiencing those symptoms?
Of prostate cancer.
Leveraging on what women do, for example, for breast cancer.
Yeah.
They can do some form of check even before they start, experiencing pain and some form of symptoms.
I'll get there. We'll get there. I'll get there. It's unfortunately you can't do checks yourself because you can't reach your prostate. But if you are reaching your prostate, then the problem. Well, I haven't said that. I've been in A&E and someone came in before and said something is stuck off my bottom. And when we got there, what did we find? A remote control. So, what? So I've seen the things I've seen in this country. All right. Okay, I'll get there, and I'll get there quickly. I'll talk about supplements. There's also some people that said supplements with vitamin E, vitamin C, and selenium might be good, but we don't unfortunately have research to support that. So signs and symptoms of prostate cancer, as I said, if it's small enough, it might not cause any symptoms whatsoever. Nothing whatsoever. But the symptoms are very similar to BPH when it's big enough, and those are the symptoms I spent some time going through with us. Now, if prostate cancer becomes really advanced, and advanced means that it's spread elsewhere. Prostate cancer has a predilection to spread to lymph nodes. So lymph nodes here in the groin, lymph nodes in the tummy, and bone. Those are the two places prostate cancer spreads to, mainly. Lymph node and bone. And I've shown you the lymph. I tried to show the lymph nodes, where it spreads to, those lymph nodes. So if it spreads to bone or spreads elsewhere, it can cause weight loss, loss of appetite. If someone has prostate issues and they have weight loss, loss of appetite, the cancer is probably already metastasized. Weight loss, loss of appetite, anemia. We all know that the bone marrow is what produces our blood cells. So if it spreads into bone, it affects bone marrow production of blood cells. So they have anemia. Bone pain. They can have what we call cord compression, spinal cord trouble, because it spreads to the spine crumbles, and it causes spinal cord problems. So one main emergency, someone with prostate cancer calls me up and says, well, I already know a person has cancer, and he tells me that I have back pain, I can't feel my legs, it's an emergency. We're taking that person straight for an MRI and doing stuff because it spreads to spine. Leg swelling, kidney failure, and things like that. Let me run a little bit. Good. This is where I'm going to spend a bit of time. Most cancers, including prostate cancer, if you find it early, stage 1, stage 2, it carries better prognosis. We can treat it quickly. And that's the same thing with prostate cancer also. Now, cancer screening for cancer helps to find cancers before they cause any symptoms. And we have established national screening for some cancers. Like the breast cancer, once a woman is over the age of 50, they invite them for mammograms, and they do mammograms every 2 to 3 years. Cervical cancer, once a woman is over the age of 25, they ask them to come for cervical smears so that they can detect cervical cancer early. And the reason why I'm mentioning that, because I could have just glossed over that, is we have wives. Let's remind them. My wife, my own wife, she will get later. She will not open it or throw it in the bin. Before opening it. You go on. So please, let's remind our wives. Breast cancer screening, cervical cancer screening, please. Then for us, bowel cancer, they would always send that thing, do your poo, please, every 2 to 3 years.
50. It
is important. If we find it early, it is more likely going to be treatable. Bowel cancer, and it's a very simple test. Now, in the UK, we don't have any such screening for prostate cancer. The US has. But screening for prostate cancer is very controversial, and I'll go into some of the controversies. What they use is what we call the PSA, which is a blood test, and then they do a rectal examination. And I'll go into the screening, the pitfalls. Unfortunately, the PSA test, and why did I do it this way? I did the slide one after the other because I wanted to tell you about PSA, but I'll just go through PSA. PSA is called prostate-specific antigen. It's a protein that is secreted by the prostate gland, whether it's cancerous or not. But when it's cancerous, it secretes it more. Okay? Whether it's cancerous or not, there will be PSA, or it secretes that. Now, this can be found in the blood or in the prostate itself. So, the problem is that the PSA test is not 100% accurate because there are other things that you can have that can make your prostate, make your PSA high. Now, because of that, you can have false positives. So, for example, after sex, your PSA goes up a little bit. After a bike ride, your PSA goes up a little bit. But it should come back down after, if you have a urine infection, your PSA goes up. But after the infection, it should come down. If you have prostatitis, your PSA will go up and should come down. But if we just find you and we just do a PSA test now, and it comes back raised, we don't know whether it's raised because of cancer, or it's raised because of this, or raised because of that, or raised because of that. So it leads to overdiagnosis. Because that would mean that because we found it raised, we then say, it could be cancer. Let's do a rectal exam. I'm not sure. Let's do an MRI. Let's do prostate biopsy. So we do quite a lot of investigations, even though it might not be prostate cancer. That's the first drawback. The second drawback is I mentioned that prostate cancer sometimes can be very slow growing, and it doesn't affect someone's life for their lifetime. So if we're screened and we find it very early, who's to say that that cancer is going to affect this person's life or not? Nobody can say it. But can anybody, the doctor tell you that you have prostate cancer, we're not going to do anything about it? Would anybody say, everybody will want you to be treated? So there's a tendency to overtreat with screening. Now, also, we've had some studies that have sat down. There's a study in the United States that found out this annual screening that they do, they are very gung-ho in the United States. They do annual screening. They found out that they detected more prostate cancers in men that were screened, but it actually did not affect death rate. It didn't lower death rate from prostate cancer. And there's another study, European study, which is a better study, did find that PSA screening every 4 years did reduce the cancer deaths. But for you to prevent one cancer death, you need to screen 700 men. And you have to detect 27 cancers. So the figures are very little. And that's why we don't have a national screening program in the UK. However, what should we as African men do? What should we as African, oh sorry, I've gone a little bit beyond. Sorry, is that me? The first thing is get as much information as possible as African men. African men, we have more risk of prostate cancer at a younger age, and it tends to be more aggressive. Prostate Cancer UK now suggests that black men from the age of 45 should consider getting a PSA test done, or at least have that conversation with your GP. Now, there's a risk calculator that you can use on prostate cancer risk calculator website. It just asks you 3 questions. What's your age? What's your ethnicity? Do you have any family history of prostate cancer? Especially if you have a family history of prostate cancer and you're over 45 and you are a black man, whether there's a national screening or not, get your PSA checked. That's my personal opinion. So you're over 45, you're a black man, you have a family history of prostate cancer, father, grandfather, brother, get your PSA checked, please. Because if we find it early, we treat it better. Yes, yes, sir.
See, if I don't fall into any of the categories there,
yes.
My age, I'm black African,
yeah.
And no family history, can I still insist that I want to have a PSA?
Oh yes. Oh yes, you can have it. You can insist you want a PSA check. The doctor will just sit you and say that, you know that if it's raised, we might go down this rabbit hole and there might be nothing. Yeah, as long as you're happy with that, you'll check the PSA.
Thank you. For me, I'm the opposite of him. I'm more than 45. My dad had a prostate enlargement, so I don't know the difference between that and the cancer. And so I've been doing a PSA check for since I got into 40 because of my dad's situation.
Yeah. Yes. That's the right way to do it. I don't think you need to check it too often, but every year, every 2 years,
Every year. I get
yeah.
notification.
Notification. That's the right way to do it.
I don't hear you. You said what I wanted to say that it will be every year. However, with NHS not trying to cut costs.
Yes.
There's a situation whereby you might be talked into, not doing it every year. I'm saying that because I experienced that, like him.
Yeah.
I'm over 45 and I died 11 years ago of prostate cancer.
Yeah.
And that time I went to my GP and the GP said, okay, we'll place you on. At first, a 6-monthly check,
yeah.
Then later they changed it to every year. But after some time, they kind of reduced that. And it will be like a fight between me and my GP. Yeah. So I ensure I have that test done every year. If you don't ask for it, they will not do it. Yeah. And you might be talking to, okay, well, you did a test 2 years ago and it came back negative. Can we do it every 3 years? So it's your responsibility to say no. I want it every year. Thank you.
That settles it for us. I mean, personal opinion, I also still tell my patients every year, but I know from research you can push it a little bit, but I think as African men, let's just stick with every year. I know from research you can push it a little bit. And I said we can calculate a risk from that side. That color didn't come out well.
Yeah. Sorry, it's only when you go for the test. They don't tell you anything. They just say, oh, sorry. They just tell you your level is okay. The level, I don't know. Okay. So I don't want to get into otherwise.
And one of the slides didn't say the levels, but I'll rush through.
No, I think just to follow up to that question, the last time too I went to GP, and after a while they said the result is okay. I'm not
and they sent it to my mail.
Yeah, they can send you. Yeah,
Yeah,
they
you
can do that.
If you ask for it,
If you ask for it, it's your record. So, the levels of PSA, we usually say that level 4 is what we generally use, but that's 4 is for under 4. I mean, because your PSA increases as you grow up, as you grow older. 4 under the age of 50, then we use higher levels for the older you get. But we know that between 4 and 10, we know between the 4 and 10 that the risk of brain prostate cancer is just about 25%. If it's over 4 or it's less than 10, the risk is just about 25%. But if it is over 10, then it's about half. If someone has a prostate level of over 10, it's about half. If it's over 100, there's definitely prostate cancer. There's no need for us to do anything after that. Well, there's need to do other things, but you see what I'm saying. Now, as I said, some things can raise your prostate. BPH, which is enlargement in itself, prostatitis, UTI, ejaculation, riding a bicycle, and things like that. Some medicines can also do that, like testosterone. Some things can lower your prostate PSA levels, like finasteride, even if you have prostate cancer.
How will ejaculation do now?
Anything that puts pressure on the prostate. That's why
Because when you're riding the bicycle, the prostate will contract. I mentioned it earlier.
So this might driving long hours.
So if your PSA is raised, the next thing they want to do is the rectal exam, which I've already mentioned before. That's the only way we can do prostate exam. I'm going to move very, very quickly now because of time. And then the next thing, if it's still raised or is abnormal, or they feel that your prostate is abnormal when they examine it, they go for an MRI scan. But the standard diagnosis is they need to take a biopsy, tissue biopsy. And the way to get to the prostate is through your bum, through your rectum. So they insert stuff and take out the cell, from there. And I said here that if you're an African man and they've taken biopsy before and they said it's normal, but the prostate still feels abnormal, your PSA keeps going up, please get another biopsy. Let them do it again. Because sometimes you can miss spots in the biopsies. Once confirmed, then they do a staging CT. I'll run through this in bone scan and things like that. Staging, Gleason's, I'll go through that. Treatment options. Let me just spend a few more minutes in treatment options. I think I wanted us to have a break somewhere, but let's just see where we get to. Treatment options would depend on the risk, the level of the prostate cancer. Low risk, we put them on what we call active surveillance. If it's low risk, when they check the tissue is low risk. Active surveillance just means that they check the PSAs regularly every 3 months and they do a prostate exam every 6 months. Because it might be slow growing if it's a low risk. And then also there can be surgery, radiotherapy, or hormonal therapy. My slide does go into all the things that they can do. Surgery is a radical prostatectomy. They can do robotic surgery and things like that. But I'll just go and rush through that because of time. Radiotherapy can be brachytherapy or external brain therapy. Hormonal injections, which someone mentioned, blocking the prostate. You only use that when the prostate has already metastasized. You use it to keep things at bay. You don't use it to cure because you're depriving it of testosterone. The testosterone is needed for the prostate to keep growing. Even the prostate cancer cells, you're keeping it at bay. It's not curative. Chemotherapy is for metastatic disease. Right. No, let's just rush through that. Let's just go through it. Because of time, I wanted us to have a break for 5 minutes, but time is up, yeah? Just rush through it. Yeah.
This is quality time.
Continue.
Yeah.
I wanted, as part of the break, I wanted us to, if you wanted to go for a break, you need to crack that code first. But let's just go. Okay, let's just do this quick quiz then. True or false? You have an increased risk of suffering from a heart attack during sex. True or false?
True, no?
True. True. And who says true? Everybody true? Increased risk of having a heart attack during sex. True. Any false in the house? Next question. Frequent sex leads to prostate cancer. True?
False. False.
False.
They all have you.
It rather helps. It rather helps. It rather helps.
Can this question be reversed?
Infrequent.
A lack of.
So, true or false? Excessive sex shortens one's lifespan.
False.
Maybe.
I said men versus women. To turn a man on, it's just one switch. You need to go through the marrow. You need to start calling out from 8 a.m. in the morning. Light flower when you're going on. Okay, let me give us the answer from these are studies that have been done. The Duke longitudinal study of aging says that the frequency of intercourse is actually a significant predictor of longevity in men, and that early cessation of sex is actually associated with premature death. So actually having sex is good for you.
Please, can you forward I don't know about them, but for me and my congregation, these are women they listen to you. I don't know about your wife. So if you present this matter to them somehow,
Brother, let me
Kunle should be the focal point.
No, it's our this is
Just a comment. It took so long for you to arrive at what we're trying to do.
That's the only thing
It was too long. To come to the conclusion that we all were waiting. Thank you so much.
oh my.
Those partners that married early or that gave birth early died at a much younger age. I'm taking time to read that particular chapter. So can we reverse this and say that the earlier you start the process, the less or the less